ketogenic group and 62% of the low glycemic group. A low-carbohydrate, ketogenic diet to treat type 2 diabetes. 28 overweight participants with type 2 diabetes were put on a ketogenic diet for 16 weeks. HbA1c, weight and fasting triglycerides decreased significantly. Out of 21 participants who completed the study, 7 discontinued diabetes medications, and 10 reduced the medications. A novel intervention including individualized nutritional recommendations reduces hemoglobin A1c level, medication use, and weight in type 2 diabetes. 238 patients received nutrition counseling and were asked to follow a ketogenic diet for 10 weeks. After 10 weeks, HbA1c decreased significantly. 56.8% reduced or eliminated at least one diabetes medication. Effectiveness and safety of a novel care model for the management of type 2 diabetes at 1 year, an open-label, non-randomized, controlled study. 262 participants were allocated to a ketogenic diet group, and 87 participants were allocated to a usual care group. In the ketogenic diet group, HbA1c, weight and diabetes medications declined significantly. Insulin therapy was reduced or eliminated in 94%. Conclusion: type 2 diabetes is not a chronic and progressive disease if one removes the offending factors from their diet, namely sugar, flour and seed oils. This is imperative because it accomplishes two things: it removes the factors causing and exacerbating the disease, as well as replace them with nourishing foods that also regulate appetite. With nourishing food, a stable appetite and having removed the disease factors, this disease will not progress but regress. Type 1 diabetics, for now, nearly always need some insulin. How much they need and how effective the exogenous insulin is at controlling their blood sugars largely depends on how well they followed a well-formulated low-carb or ketogenic diet. What it comes down to is that the diet allows you to deal with the easier task, covering your basal insulin needs. Off the diet, people are faced with the harder task, covering basal insulin needs plus those arising from carby foods. Diabetes, whether type 1 or 2, are diseases extremely susceptible to the therapeutic level effects of diets that lower insulin. If those diets are also nutrient-dense, evolutionarily matched to humans and produce a more generally preferable shift in metabolism, then all the better. This sort of dietary treatment for diabetes holds great promise in their potential for helping out in other diseases like cancer, Parkinson's and Alzheimer's disease.